Now the frontal plane of movement, the main movement we're going to check is the side flexion towards the left and then side flexion towards the right. The starting position for the patient is exactly the same. The starting position of the therapist again is like more of legs are apart rather than a walk standing position. So legs are apart, yeah? So the same head is supported on your trunk. I'll first demonstrate on the model first, and then after that I'll show it on the model. So your hand, now for the sagittal plane, your hand goes onto the interspinous space, yeah? For the side flexion, it has to go onto the transverse process. So you palpate onto the transverse process, your hand onto the sides of the transverse process, and then you create a side flexion moment. So when you create a side flexion moment, you're looking at the closing up of the transverse process on the same side, and then the opening up of the transverse process on the opposite side. So once you opened up, and then after that, you're trying to bring it back to neutral. Are you with me? So from there, you're trying to push the transverse process onto the side, opposite side. You're palpating or feeling for the opening up of the transverse process on the side. And then from there, opening up, you're trying to bring it back to neutral and looking at the closing up of the transverse process. Once you check on the one side, and then you can do it on the other side. So when you push the transverse process to the other side, you're feeling for the opening up of the opposite side and feeling the closing up of on the same side. Once you identify, bring it back to neutral. So you're looking at the quality and then the quantity of movement. How smoothly the segment moves between one segment to the other. And then you're also looking at the quantity, how far it moves from one level to the other level. So once you identify from C to C3, you move on to C3, C4, and you go down to the lower cervical and feel for the opening up and closing up of the transverse process. So for the sagittal plane, you're looking at the opening up and closing of the spinous process. For the frontal plane, you're looking at the opening up and closing of the transverse process. Are you happy? Yeah? Right. Can I ask someone to come as a model?
Yeah.
Take it top off. Joe, if you can ask you to slide up towards me. Further up slightly. So patient in a starting position, you can give a clear instruction to the patient what you're trying to do, and then again you can palpate the muscles around the neck, make sure that the muscles are relaxed. If the muscles are tense, you expect that the movement will be less because of the stiffness, yeah? So palpating the muscles of the sternocleidomastoid, mastoid, scalene, and then the posterior neck muscles to make sure the muscles are relaxed. Once if it's relaxed, patient is confident for us to go ahead. So you palpate you place your head on the trunk. Is that okay, Joe? Yeah. And then your hand goes onto the sides of the transverse process. So on the opposite side as well as on the same side. You see that? And then you're creating a side flexion. Is it okay, Joe? Yeah?
Yeah.
And then when you push that on that side, you're looking at the opening up of the transverse process on the other side. From there, you're trying to bring it back to neutral. And then check on the other side. So pushing that C2, C3 vertebrae down to the side, and you're feeling for the opening up of the transverse process on the side, and then you feel the opening and then coming back to neutral. You got me? So again, stabilize. Can you see? That's the mid cervical. You're pushing down towards the side, feeling for the opening up of the transverse process. From that opening, you're trying to bring it back to neutral. And then you're trying to check on the other side and comparing the mobility between the right side and then the left side. You're opening up of the transverse process on the other side and closing up of the transverse process on the same side and making sure that the both sides are moving at the same level. Once you're happy, and then go on to the lower cervical, and then you're trying to create that side flexion movement. So if you're looking at it, I'm not just bending the neck, yeah? But I'm using one hand to push the transverse process to one side as well. So I'm creating a bending moment. I'm creating a bending moment from one side. I'm just comparing to different levels. Do you see that, yeah? And I'm just using the other hand to feel for the opening up. So if I'm using side bending towards the left shoulder, I'm using my left hand to push the cervical spine to the side, and I'm using my right hand to feel for the opening up of the transverse process. So you don't get that kind of a greater mobility unless until the patient is cooperating to you. Do you see that? And once you're happy, that's the screening of your frontal plane. Do you want to give it a try? Thanks, Joe.